Hello, my name is Dean Barr and I head up RSHQ's Occupational Health Division. Today I'm going to provide some reflections on my division's work during the last financial year, including our capability uplift to regulate for sexual harassment, coal industry medical audits, res health and disease trends. I'm then going to touch on focus areas for us leading into next financial year. This will include proactive audit work on sexual harassment, spirometry audits, our clinical pathway, and some new research that's being completed later this year. My three key messages I'd like you to take away from this presentation are: 1, ensure your site has effective controls to reduce risks of workplace sexual harassment and report incidents to RSHQ. Ensure any new health assessments for coal mine workers commenced from 1 April are completed using Res Health. And the 2022 spirometry standards must now be used. RSHQ audits will commence later this year against those standards. Firstly though, I'd like to spend some time on sexual harassment. Let's be very clear, sexual harassment in any form or in any place is not only unacceptable, but also prohibited in Queensland under the Anti-Discrimination Act 1991. Obligations exist at federal anti-discrimination and fair work legislative frameworks. Employers also have obligations under general workplace health and safety legislation in Queensland to protect workers from psychosocial hazards, including sexual harassment. Clarifying amendments to Queensland's workplace health and safety regulation and a new code of practice are effective from 1 April this year. While off-site workplaces are the Office of Industrial Relations jurisdiction, obligations also apply to resources operations in Queensland regulated by RSHQ. We know from learnings in Western Australia's mining industry that sexual harassment is an issue that must be addressed. And like WA, regardless of the jurisdiction that applies, we need to ensure our collective effort is improved to prevent workplace sexual harassment, including managing risks of other psychosocial hazards. However, reporting to RSHQ of sexual harassment on resource sector operations remains low. Only 25 incidents or complaints have been recorded over the past 5 years. And while around 50% of these incidents relate to sexual assault reported to the Queensland Police, sexual harassment is also occurring in our industries in the form of stalking, sending explicit material, unwelcome touching, offensive comments and sexual gestures. Obligations to report serious and high potential incidents to RSHQ also apply to sexual harassment, as those obligations are defined under our legislation. While I appreciate there's a threshold question about when those obligations apply, anything of a serious nature or particularly egregious behaviour triggers that obligation. Over the last 12 months, RSHQ has uplifted our capability to regulate for sexual harassment. We now have dedicated officers to take reports and investigate incidents and complaints. These officers have received additional training and we have recruited new team members with psychology backgrounds. We also have a dedicated phone number, 1800 581 077, for industry reporting and working complaints that links directly to our dedicated team. Complaints can be made to us anonymously over the phone or online. Our website has been updated with information for operators and workers about managing risks, making complaints to RSHQ and support service available to impacted workers. The QR code on screen provides a direct link to our webpage, and we also have some pocketbook cards with relevant information that we can provide to you free of charge. Over the next 12 months, RSHQ will continue to build on this capability, including proactive audits of site safety and health management systems to ensure effective controls are in place. We will also be exploring developments at a national level around consistency of industry reporting obligations and broadening our focus to psychosocial hazards more generally. And as always, we'll continue to work closely with our interagency colleagues, including the Office of Industrial Relations, to collaborate on our efforts wherever possible. So, if you haven't included psychosocial hazards and sexual harassment in your risk assessments, implemented a proactive leadership culture, reviewed your relevant policies, procedures, training and awareness programs and reporting processes, I would strongly urge you to do so. In doing so, ensure you have a victim-centric approach and minimise risk of re-traumatisation of workers through that process. There are many resources available on our website that can assist industry implement effective controls. Now moving on to audit work we undertook this year on employer compliance with their obligations to arrange and pay for coal mine worker health assessments. This was undertaken given the importance of the obligation from a risk-based approach and that we have received a small number of related complaints. 100 employers were audited across central Queensland coal mines, and in general we found compliance was high. Employers were also very cooperative and engaging in the process, recognising the importance of the medical scheme. The main non-conformance identified was some employers not arranging for assessments for new employees, relying on an in-date report from a previous employer's doctor. Employers of coal mine workers are reminded that the Coal Mine Workers Health Scheme requires an assessment to be conducted for new employees, and this assessment can rely on in-date medical examinations completed under previous employment, for example, a chest X-ray examination, but the new employer's appointed medical advisor must consider that new worker and complete a new assessment report. During the audit, in a limited number of cases, workers had paid for their own assessment or been later reimbursed. We found this was generally limited to small businesses that hadn't been aware of their obligation. However, again, I remind all employers the scheme requires the employer to pay, and this should be done directly wherever possible. RSHQ will continue to monitor compliance with these obligations. A reminder for the coal industry that from 1 April this year, all new health assessments must be commenced by the employer using ResHealth. ResHealth is the new online system for employers, workers and doctors to complete health assessments under the Coal Mine Workers Health Scheme and submitting those records to RSHQ in real time. ResHealth can be easily accessed via our website from the link in the top menu of our webpage, and there is a range of education and support material available through the support guides link on the left-hand side menu. This material includes tutorial videos, FAQs and process flow guidelines, and any assessments underway and commenced prior to 1 April can be completed using the previous process. Over the following months, RSHQ will be providing ongoing education awareness for industry on the use of ResHealth. These are available for employers and medical providers through webinars that can be booked through the support guides webpage. Use of ResHealth is now mandatory, and any assessments not commenced with ResHealth will not be compliant under the Coal Mine Workers Health Scheme. It's important to reflect on the cases of disease being diagnosed, as it's a reminder why reforms such as ResHealth are so important. A number of workers continue to be diagnosed with mine dust lung disease cases, and this is expected given the long latency of disease. Cases are rising among workers in the mineral mining and quarrying sectors, as well as retired and former workers. As at end of February, case numbers are on track to be similar to the total number reported last financial year. I'd like to remind SSCs of their obligation to report prescribed diseases to RSHQ, including mine dust lung diseases like coal workers' pneumoconiosis and silicosis. This figure shows the reporting pathways of cases reported to us for workers from the mineral mining and quarrying sectors. Majority of these cases are reported to us via the Workers' Compensation Scheme. Aside from the regulatory requirement, SSC reports to RSHQ from this sector are vital because, unlike coal, medical records for MMQ workers are not submitted to RSHQ. In addition, not all workers seek compensation, and the information available to us from the Workers' Comp Scheme can be limited. Later this year, we will also be conducting spirometry audits of RSHQ-approved medical practices. Auditing of the scheme was a recommendation of the Monash Review when in 2016 it found about 40% of spirometry tests it reviewed had quality issues. Our last spirometry audit campaign completed in 2021 found significant improvement, with the number of tests with quality issues down to 13%. This year, looking forward to further improvement, noting that the new 2022 spirometry standards published 12 months ago are now mandatory from 1 March this year. Before I conclude, I'd like to mention two final things. Firstly, many of you would have seen our ongoing consultation on the revised clinical pathways guideline. The Resource Medical Advisory Committee has now endorsed the final version of the revised guideline, and it's now available on our website. The guideline includes changes that incorporate learnings from implementing the 2017 version and enhancements to achieve better outcomes, including dual reading of CT scans by B readers, confirmation of spirometry results to avoid unnecessary referrals, allowing mild lung function impairment to be managed without specialist referral, and guidance on work-relatedness of COPD in smokers. Thank you to all stakeholders that provide input to the revised pathway, and especially the RMAC members for their time and expertise. And finally, to flag that we are expecting Monash University to complete its research into cancer mortality trends of Queensland coal mine workers later this year. This hasn't been attempted before and will provide deep insight into the long-term health of our workforce that can help us with improving controls. So that's it for me. Thanks very much for your time. Please remember those three key takeaways. Implement effective controls for sexual harassment and report incidents RSHQ. ResHealth is now mandatory. and spirometry audits against new standards will commence later this year. Thanks again for your time, and I look forward to seeing you around during the year.